Hello, everyone. Thank you for being here. My name is Lexi, and I'm a student of public health at the Harvard School of Public Health, and today I will be presenting on behalf of our work with AAPH colleagues. So just to give you some background on this research, as many of you know, adolescents face the triple burden of malnutrition, which is the co-occurrence of undernutrition, overweight and obesity, and micronutrient deficiencies. And some of the causes for this include shifting diets, sedentary lifestyles, poverty, and a lack of healthy eating awareness. So what do we do about this? Well, as we know, adolescence is a critical period for development, so it's a key point where we can intervene, especially to improve on shifting dietary habits. And schools offer a key platform to do this, as we know that school enrollment rates have been increasing dramatically and students consume at least one or more meals during school time. In Tanzania specifically, 23% of the population are adolescents. However, little research exists on their health and nutrition. So what we've tried to do in this study is explore adolescent nutrition and the school food environment in Dar es Salaam city by examining three factors. First is the prevalence and predictors of malnutrition. Second is adolescent eating habits. And third is food vendor offerings in and around the schools. So how did we do this? We took a mixed methodology approach with three different components. So first was a survey given to adolescents in school with self-reported information of students aged 10 to 14 that were randomly selected from 20 government schools across 5 districts of Dar es Salaam city. Second, we held focus group discussions with 42 adolescent students to really delve deeper into their perceptions of health, nutrition, and the school environment with which they participate. And lastly, a survey was conducted with around 300 food vendors that were located either within the school premise or within a 5-minute walking distance around the school to understand what types of food were being sold. So what did we find? First, we'll look at the results of the adolescent survey. 1,257 students participated in this survey, and about 52% were girls, and the mean age was 11.5 years old. So when we looked at the prevalence of malnutrition, we found that 9% of students were underweight and 13% were overweight or obese, according to WHO gross standards. We also found that over half of the students were anemic. So we did some multivariable regression analysis accounting for gender, age, and education of the female and male guardians to understand what might be some predictors of these numbers. The significant results that we found are that females have significantly higher odds of being overweight or obese compared to males, and adolescents with 3 or more siblings had higher odds of being underweight compared to those with no siblings. To further look into these numbers, we wanted to understand what adolescent eating habits look like and what are these drivers of these patterns. So first from the survey, we found that adolescents, many actually skip breakfast. However, they are consuming lunch during school hours, whether bringing food from home or purchasing it from food vendors. And as you can see on the left, we also looked into the type of foods that adolescents are consuming. Specifically, this graph shows consumptions of food items more than once per week. And you can see that the students are consuming a high amount of refined grains and baked goods, fried foods away from home, sweets and ice cream, sugary juices, and much less different types of vegetables and fruits. So in order to unpack why adolescents choose to eat these foods and what their eating habits are and how they're influenced, that's where the focus group discussions came in. So 4 key themes emerged from these discussions around how these choices are being influenced. First, adolescents mentioned they have limited financial means to procure foods. In Tanzania, there is no national school feeding program, so parents have to provide the students with money to purchase food at schools. So as you can see in the first quote, one participant said, "Often we don't have money to buy food, yet we have to spend the whole day at school and learning becomes difficult." Other themes that they mentioned are concerns about food safety, which you can see in the second quote that said, "The food we buy and eat is not safe. For example, I'm sure the water used to prepare ice cream is not boiled." A few other themes were There was a lack of availability of food options that adolescents desired. And finally, there was limited knowledge of what consists of a nutritious food. And finally, just to share with you the findings of the food vendor survey, this here shows the percentage of vendors selling the following items on the day that the survey was conducted. So as you can see, vendors highly sell snacks like chips and biscuits, processed foods, beverages, which include sodas and sweetened juices, and many less animal products and fresh fruit options. So what does this mean? The implications of this research are together we need to develop strategies to assist schools to prioritize adolescent nutrition by promoting healthy eating habits, enhancing access to more nutritious and quality foods, and finally addressing some of the barriers these adolescents mentioned. And in terms of what is next, I'm happy to share with you that we are currently conducting qualitative research in 2 secondary schools in Dar es Salaam City to explore the role of food vendors specifically and how they can shape a positive school food environment by providing more accessible, affordable, and nutritious options to students. So we just wrapped up the primary data collection for this initiative, and I'll be happy to share with you the analysis once that's finished. So thank you so much for listening, and I'm happy to answer any questions.